I do what? Oh, at the back table back there. You can share mine.
So I want to welcome folks who've shown up tonight and thank you for coming tonight to the Windham County. So I'm going to welcome folks who have come tonight and thank you for coming to the Windham County Forum on Healthcare and Human Rights. This forum's been organized by the Vermont Workers Center, and our thanks go out to everyone who helped make this forum happen, especially our volunteers who helped get the word out and are helping here tonight. A special thank you to the candidates who have joined us here tonight. Unfortunately, a number of candidates were unable to come due to conflicts or having to work. I'm going to just go over a few logistics and then introduce the candidates and move on from there. So I'd like to introduce the candidates who are here tonight. I'll start at that end and sort of move along here to this end. Jerry Levy, who's running for Senate. Aaron Diamondstone, who's running for Senate. Jeanette White, who's running for Senate. Becca Ballant, did I say your name right? Ballant? You did. I meant to ask you. Becca Ballant, who's running for Senate. Emily Kornheiser, who's running for House from District 2-1. Molly Burke, who's running for the House from District 2-2. Tristan Tolino for the House from District 2-3. Matt Treber, who's running for the House from Windham 3, and Emily Long, who's running for the House from Windham 5. And we may be joined by Tyler Colfoot, who's also running for Senate. The Vermont Workers Center is guided by a vision for the future of Vermont that rests upon the essential belief that as human beings we're entitled to lead our lives with justice, dignity, and well-being. When we talk about the human right to health care, we include in that the social determinants of health, such as poverty, access to food and housing, a clean and safe environment, and freedom from discrimination on the basis of race, gender identity, class, age, immigration status, disability, mental health status, or any other factor. Obviously, our ability to access needed health care is extremely important, but our health encompasses much more than that. We also include the rights of healthcare workers in the scope of the human right to healthcare. Our nurses, LNAs, techs, home care workers, and others who provide frontline health services themselves deserve the dignity of a living wage and dignified working conditions. These are the same things that allow us as patients to experience continuity of care and to know that if and when we need care in a hospital or another facility, the staffing levels will be adequate to provide safety to both patients and workers. This January, our legislature will take their seats at a time of great uncertainty coming from Washington. It is likely that Vermont will experience fallout from projected federal budget cuts, in the face of which legislators will be called upon to make decisions that will impact the lives of people across our state. These include decisions about health care and many other public services, including those that people rely on for access to food, housing, childcare, transportation, and other human needs. About a third of Vermont residents rely on Medicaid for some essential services, not only health insurance, which is what most of us think of when we hear Medicaid, but also various disability services that receive Medicaid funding. According to the U.S. Census Bureau data, reported by Public Assets Institute, in 2016, 1 in 9 Vermont residents faced poverty, including 11,000 children. And Vermont was one of 4 states to see a rise in poverty from the prior year. This is the context in which our legislature will be taking up the people's business. The Vermont Workers Center is committed to organizing for a path ahead that recognizes our shared humanity and our human rights. This path will take courage, but it can take us out of a deepening crisis while advancing human dignity and equity in Vermont. By choosing this path, we commit to meeting all health needs in our communities and financing our healthcare system through equitable taxes. We commit to transitioning to a sustainable economy with good jobs that help provide what our communities really need, while enhancing and embracing rights and dignity in the workplace. We commit to a budgeting process that succeeds in meeting people's needs as well as raising revenue equitably. And we commit to grounding economic development in policies that preserve and sustain our environment. This forum will include several questions from Vermont Workers Center members that address healthcare and human rights. After each of those questions, I'm going to take a question from the audience. You're welcome to address your question to all the candidates, Or if you're from a particular district and say you want to address the Senate candidates and the person who would be running to represent you in your district, you could do that. That's really your choice.
I'm Spoon Agave. I know a lot of you. I have one prepared question. I may have more later. My prepared question is, in 2011, the legislature passed Act 48, calling for universal health care by 2017. And it, as you're of course aware, that has not happened because there has never been a vote on a financing proposal. What specific measures would you propose or support to ensure that universal health care, distinguished from, not limited to, primary care, but universal health care, becomes a reality for everyone in Vermont?
So I'm Emily Long. I live in Newfane, and thank you for having us here tonight. This is a great opportunity for us to have a chat with all of you. I believe very deeply that all Vermonters should have access to affordable health care, no matter what their living situation is. I remain very concerned about not only just those in poverty, but also our middle-class families who are struggling in their own way because they can no longer afford to pay the mortgage, the health, their student loans, and the cost of living. You know, it makes it very hard for all of them. As far as coming up with a funding formula for universal health care, I don't know if we have a smooth, clean path forward, and I don't believe we do yet have a path forward for that. But I do believe that incremental steps are critical to this, and I think we've been trying to focus on that. We did look at primary health care for all, and I think we were unable to move that forward. I do think that the teachers' health insurance being moved to statewide is going to take us another incremental step. So I feel pretty, is this 1.5? I get 2?
Yeah,
okay. So I feel like we need to move forward with that to see if we can try to find a path forward to cover all Vermonters in healthcare.
Hi, I'm Matt Trieber. I represent Rockingham, Athens, Grafton, Windham, Brookline, and Westminster. So I don't know a lot of you. But we lost the fight on messaging taxes a long time ago and have stopped having real conversations with Vermonters about how they are paying taxes for healthcare, whether they know it or not. You have a set cost that goes into your healthcare insurance as a premium, then a cost for a deductible, then your cost for co-pays. All those things are healthcare taxes. Anything from a cost shift that happens from the uninsured or underinsured, where hospitals have to write it off and the Green Mountain Care Board changes the billable rates, those are all taxes. And we have gotten to the point where we are afraid to have a conversation with Vermonters to say, there's a better way of doing this, where you just bring out those taxes that you're paying and call them taxes. And then we could provide the services that are necessary and that every Vermonter is entitled to. We do that with all sorts of areas related to poverty in the middle class. We do that with childcare. We do that with higher education. All these things are taxes that people pay, but unfortunately we've been so afraid of that, of calling things taxes, that we don't, that we've been hesitant to put anything forward where we could be accused of a tax increase.
Hello, I'm Tristan Tolino. I represent Brattleboro 2-3, which is 1/3 of Brattleboro, but we work together as a team to represent our town. So I think that I don't want to sound negative, because I want to start by saying, of course, I actually do want to see a universal healthcare system, but I think the landscape politically has shifted a lot in the last 5 or 6 years, and particularly in the last year or two. And it's and fundamentally, this has got to be a partnership with larger entities, whether that's the federal government or whether that's a regional system, because Vermont just simply doesn't have the scale to make the financing work, in my opinion, on its own. That isn't to say that Matt's point is not valid, that we are paying for it already, but to move ourselves into an entirely new system based on a substantial increase in the accessibility is going to require understanding the business models that drive our current system and how we adapt to a new future. And the federal government, in the time period that we passed that act, although it was passed before, I think before the term before I got into the legislature, was at that time trying to figure out how to partner with states to move us in that direction. And we have a very different dynamic now, where the system that was built that has helped Vermont move into being one of the highest rates of insured in the country with some of the best health outcomes, that system is being dismantled at every turn at the national level. And I think, so it feels very important to me to continue to try to work on this issue, but also to acknowledge that this is a national and local issue and that we're not going to be able to do it on our own, in my opinion.
Loyalist coward.
What?
That's what a loyalist coward would say.
Don't worry.
Go ahead, Molly.
Oh, I'm fine. I just didn't hear the first one.
Molly Burke. I represent another part of Brattleboro, and I agree with everything that's said. I totally support moving to universal healthcare. It's so amazing to me that we just have not been able to do this, and we were so hopeful back whatever that year was when we had this healthcare policy expert come and say how we could do it and how we could save money and all of that. We were really, really excited about it. I was at a legislative trip to Montreal, and we were talking to one of the people who was giving a presentation, and somebody said, well, you pay a lot of taxes in Canada, you know. She said, yeah, but you pay too. She said, we have free health care. We have subsidized child care. We have, you know, all the things. She's rattled off all the things. And I think that conversation about, you know, taxes is really, I mean, people are like, don't tax me. And yet we are being taxed. And I think that part of what we need to do is change that conversation. And I think that we need advocates very strongly, and a lot of people who are starting to realize what we need in terms of healthcare and how it's unsustainable the way the rates keep going up. So we will all be working together.
I'm Emily Kornheiser. I am the Democratic and Progressive nominee for Windham 2-1, which is the third part of Brattleboro. And and I have some privilege that folks who have spoken so far did not, in that I have not served in the legislature yet. So I can afford to be, I think, a little more idealistic right now. So forgive me. And one thing that I also, in my third of the district, I think has the vast majority of dirt roads. And I walked down all of those dirt roads, and the conversation that I had as I knocked on every door was exactly the conversation that Matt was talking about people being afraid to have with Vermonters. And that was really moving the conversation about property taxes to a conversation about what do you get for your money, what are taxes for, what is government for, and how much money are we all spending as a community. So what I think we need to do is move this beyond politics and see about, it's not just the cost to individual households, it's also the cost of social indicators of health, which are the same as the social indicators of education. So it's the cost not just to our human services and to our education system, but also the cost to small businesses who are paying exorbitant fees as employers, as well as the cost both financially and personally to every citizen of the state. So I think we need to have that conversation larger, go beyond politics with it, and really think much more broadly about how we account for different costs.
You still have 30 seconds.
I know, but that was the last thing I wanted to say.
I just want to make sure you do that. I did.
Very well.
So I'm Becca Ballant. Excuse me. I'm running for Senate for Windham County.
and I'll be running for my 3rd term. I want to start by saying that Matt Trieber is absolutely right in terms of we have lost the conversation and our ability to talk about taxes as investments. And we really need to shift the conversation back to that, because it's not just investments on the health of people who are struggling now, it's investments in programs for adverse childhood experiences, for mental health care in the school, that you're investing early on so that those folks do not have higher costs and troubling consequences later on. But we need to get better and be on message together about that as investments. Now, Senator White and I both co-sponsored the Universal Primary Care Bill, and I understand, Spoon, you want to know how we're going to get beyond just universal primary care. And I just want to highlight that oftentimes in the legislature, we must do things incrementally because we do not have the votes on the floor to get universal health care through both chambers. And this is the landscape that we're dealing with. I'm hoping that in the House, we're going to have a veto-proof majority after Election Day. But we had so many things struck down by this governor, including something that would help us pay for the costs of health care, which is the opioid tax. That we should be taxing the opioid producers at a very high rate to help us cover the costs that have been incurred by this scourge. So it's complicated. Like all of us up here, I want to see universal health care coverage for all Vermonters.
I'm Jeanette White, and I, along with Becca, serve right now and am running again for the Senate many times. So we need to take steps, I believe, and the primary care was a step last year. And when we talk about health care, we need to talk about real health care. We need to include oral health, eye health, and vision health, and mental health. We can't separate it up from the neck down and the neck up. So we need to address all of those. I was going to introduce a bill last year. I didn't because our big fight was going to be around primary care. I am going to introduce it this year. And what it would do, and I know this is already being opposed by the unions, but what it would do, it would take all publicly funded employees, town, state, county, municipal, Vermont State Colleges, VSAC, and put them into the same health care plan. In my opinion, that's the beginning of a universal, that's the beginning of a single payer system, because now you have a body of people in one plan that can now, and then there's a provision in there that people will be able to buy into that, individuals or small businesses. So I think that we can go in that direction, and that, in my mind, is a step. I've already gotten messages from the unions telling me not to do this because they've given up salaries for health care benefits. But at some point, if we're going to do universal health care and we're going to have it available to all, everybody has to jump in. So that's one of the plans that I will put forward this year.
Aaron Diamondstone, Liberty Union candidate for State Senate. My approach is slightly different. I think that my judgment is that all the other candidates I've heard so far are trying to work within a broken system of capitalism. Capitalism is built on growth. Everybody's here for a short period of time, somewhere between 20 seconds and 120 years. I don't see why any one person's time should be valued more than anybody else's. Rocket scientists to garbage collectors. So a universal basic income with 100% tax over that limit. I'm not sure what the number should be, but everybody gets the same amount of money every year. Man, woman, and child. Everybody will have health care. Everybody will have food, and everybody will be treated the same. I don't think we can work within this broken system. It doesn't work. Capitalism is built on growth, and growth in corporate profits, growth in local tax bases, growth in GDP on the federal level, and the only place growth comes from, in the end of the day, is from population growth. It doesn't work. This planet is in sad shape now. It needs a lot of help. and we're not gonna get it with the system we have. Thank you.
I commend the efforts of our legislatures to get universal health in a broken system, and I agree with what Aaron has to say. I want to talk about Windham County. There's too few doctors here, or so it seems, because you can't get a doctor. There's too few nurse practitioners, but there's a zillion fine massage therapists, Reiki people, other forms of healers who are left outside the system. So we have all this talent which we can't use. So I think basically people of means, like myself, I can afford a massage once a week. Everybody should do that. And if I'm entitled to one a week, everybody should be entitled to one a week. And I think there are ways to finance it informally through exchange. I think we really have to think of, particularly where we're, obviously heading towards a fascist dictatorship. We have to think about what resources do we have in Windham County and how can we harness them so that people like Rupa Cousins, a great healer who passed about a year and a half ago, couldn't make ends meet. Why is that so? So I think I commend the legislatures, do what you can. I'm sure I couldn't do better, but let's start having a conversation about what we can do here in Windham County.
My name is Nick Biddle. I live here in Brattleboro. Tristan, you're my representative. I understand the relationship between the state and the federal government and how dependent the state is to federal, coffers. And so you sit, most of you sit in Montpelier and know that Bernie, says over and again his program of universal health care, forget student debt, et cetera, et cetera. And I learned in the last 18 months from his economic advisor, Stephanie Kelton, I don't know, okay, good, about modern monetary theory, which I don't want to go through because I'm accepting that several of you are familiar with it, and I see smiles. And so my question would be, to the degree that we understand that, or you understand that, how could you bridge with Bernie and whoever our representative will be to invoke that theory, modern monetary theory, for these purposes? How can you help Bernie help us? I guess is really what it boils down to relative to these questions, universal health care, student debt, and so forth.
Could you give like a one-sentence explanation for anyone in the audience or watching on television who doesn't know what modern monetary theory is? Is there a brief way you can explain it so everybody knows what the question is about?
Modern monetary theory is based on the notion, the truth, that there is no money on the earth that is not fiat currency. That's to say, it is created by its own national governments. If that's true, the largest economy on the earth, which is the United States still, is the determinant of the value of all currency. Therefore, the United States is capable of creating as much currency as it chooses, and the world will accept that.
It's bogus. I have my own theory. Basically, there are resources, and there are people who control the currency so they can dominate those resources. So if we want to help Bernie, or anybody else who's might be going in the right direction, we have to take control over our resources and tell people that they can no longer determine the currency, that we have our own currency. I suggested we have a lot of massage therapists, put them to work. We need more doctors. We have teachers who are unemployed. We have hundreds of talented people who come to live in Windham County who can't make a living because the local and state and national governments don't have enough money to pay them. We have to find a way to pay them. And if we can't pay them with currency, we have to pay them with our skills, what we can do. It's quite simple, really.
It's a tough question in the sense that I don't really particularly want to help Bernie. He's maybe a leader, but he's still trying to work within a broken system. And the broken system has US dollars as a world reserve currency. And the Federal Reserve can keep printing money, there's no doubt. The interest rates go up, inflation goes up, and it doesn't help anybody. If we all had the same amount of resources, and I don't mean just people in the United States, I mean everybody all over the world. There's one race, the human race, and everybody needs to be treated equally and have the same, not advantages, what's the word, the same privileges as everybody else. And so I'm not really that interested in helping Bernie. Yeah, it's a broken system, as I said before, and it's not working, and I don't think it'll last that much longer.
So this is so far out of whatever I know that I'm going to tell you I know a lot about the judiciary system, I know a lot about law enforcement, I know a lot about healthcare, I know a lot about a lot of things. I don't know anything about this at all, so I'm going to pass.
Thank you.
And I'm still gathering my thoughts, so I will hope it will come back.
I think modern monetary theory is sometimes called post-Keynesian economics, which might be more familiar to more people in the room, possibly. And I agree, we're very limited in what we can do beyond the federal level if we're thinking about economics in that way. So in terms of ways to influence federal monetary policy, I think what we can do right now here in Vermont is that we have a lot of people who live in the state who think of it as an incredibly left state because we have Bernie as our senator, but we have a Republican governor. We have a lot of Republicans in the legislature. We have some people who aren't Republicans but are certainly quite middle of the road in the legislature. And I think if we want to make a difference given the horrors of the federal landscape right now, that we're going to need to do it state by state in the same way that the Republicans went state by state. And so I think that for folks who are here and folks in our community who are, volunteering for Swing Left and we're really focused on the national stage for politics, there's real opportunities here in Vermont to make changes here that can lead us nationally. And I think that's a very valuable opportunity. The one real leverage point that I see in Vermont around modern monetary theory is the state bank. And I think the conversation around the state bank got very caught up in a divestment conversation, which I think is a valuable conversation to have, but I don't think it's necessarily helpful politically when those two conversations are tied together. And I would really encourage us to think about separating those two conversations if we really want to move towards the power and flexibility the state bank would give us.
I can't say anything about modern monetary policy, but how can we influence Bernie? And I think it is true, I'm concerned a lot about the money that's pouring into Vermont to try to turn Vermont into a red state. I mean, we have to be really, really cognizant of what's going on. And it's a very, very scary landscape. So I think we need to be really proactive on so many fronts and not think, oh, well, yes, Vermont, we'll just sort of keep on a progressive sort of path. So that's just something that I'm thinking about. I don't know if it's really completely relevant to your question.
I think I'm going to agree with Jerry at the end there, largely that I don't necessarily think that the monetary policy is the primary place of leverage. I actually think that federal tax policy is a bigger determinant of the inequities in our current economy, that we've seen massive increases in the finance sector, the financialization of our economy, that's supported by things like the carried interest provision that allows big money managers to make monstrous profits even if nobody else does benefit from their work. And they basically have taken a chunk of the economy that historically wasn't theirs, and they've taken it out of workers' wages and put it in their pockets at very low tax rates. And I think that that's fundamentally what has changed in the last 20, 25, 30 years, the modern economy, away from one that has a robust middle class and a real sense of movement. The whole American dream of upward mobility was based on an era when that was really true. Post-World War II, it's no longer true. It's largely not true because of the power that people have had over who gets to benefit from the economy when it's successful, and I think that's much more of a leverage point than the monetary policy is. And I think it will help Bernie if we can figure out how to dismantle the political framework that allows that inequity to persist.
Being that your question related to a specific monetary policy, and I'm not an economist, out of respect to all of you, I'm not going to waste the time sort of making up something. So I'll get back to you the next time.
However, I will just say the division of wealth in this country is growing and pretty disturbing to me. And I think we need to be focused a lot more on what our values are, because when we talk about taxes and our fear of taxes, and we hear a pretty strong mantra coming out of a lot of folks in Vermont lately, saying that our taxes are too high. I'll use the school funding for one example, where we hear that property taxes are too high, and I'm not going to argue the fact that people feel property taxes are too high, and yet Vermonters are consistently paying and voting to support their school budgets. So I think we need to keep that in mind.
So I kept, what is your name again?
Nick.
Nick, I kept coming back to where you started, which was, you know, how can we help Bernie, or how can we amplify that message? And I know this is not going to be news to you, we are stuck in this dynamic of talking about scarcity, right? And we are constantly pitting groups in Vermont against each other. And so when I was thinking about, Bernie came to the State House when we were able to pass a minimum wage increase. And he came to really thank those of us in the Senate who are able to get that over the finish line. Of course, it was vetoed. But when he was there, we talked about his plan for free college. And one of the things that we said to him was, this is a non-starter because the governor has already pitted the free college program against helping the Guard or not helping the Guard. So, and then when it was, we wanted to increase funding for early education, he said, well, you can't do that because I'm going to take it from early education to put it into higher education, right? And so the conversation before it even starts in the State of the Union is already framed by the other side, essentially, and then we're constantly trying to play catch up in this scarcity mindset. And so, like Matt said, I am not an economist, but I understand that the framing needs to change, and we on the left need to get better at controlling the conversation, because when we're stuck in this scarcity mindset, we end up with nothing that we want for the people back home.
This is around disability rights in the budget. Last year in the legislature, the governor's proposed budget cuts to services for people with disabilities, some of which are partially funded with Medicaid dollars. Anticipating that the federal budget is likely to include cuts in Medicaid, what specific measures would you prioritize to defend against cuts to programs that ensure people with disabilities are able to live as independently as possible?
So that was a pretty scary time, honestly, last winter when the governor was taking away the supports for those who are disabled. And we made sure that we restored those cuts. I think that, again, we need to be talking about human rights. And for folks that are disabled, they came to the State House. They came, I serve on the Education Committee. They came into us at the Education Committee and spoke to us about what this actually means. Again, I will say, when we talk about these things, we need to start talking about our values and what we believe is right. We need to treat all people fairly, and those who are disabled need to have the supports for their disabilities.
I serve on the Appropriations Committee, so we construct the budget throughout the year and had a fair amount of conversation about that. I think there's an even larger question to the one that you're asking when it comes to fairness to people with disabilities and disability rights. Just as full disclosure, I also work for the Department of Disabilities, Aging, and Independent Living. But I think one of the most frustrating things to me is the inequity of service that's provided throughout the state. And the mechanism that the state chose many years ago to provide services for people with developmental needs was the designated agency system, which to people in the system has amounted to little more than state-maintained monopolies. If you happen to be in an area where the service is good for you, that's wonderful. If you're not, good luck. That's even scarier to me, that the success of a person is guaranteed by where they live in the state rather than their needs. So like Emily said, we were able to push back that cut. Additional cuts are coming, but I think if we want to get serious about the conversation, we need to make sure that services are provided fairly and equitably throughout the state to any Vermonter that needs them.
To extend the point about how the designated agencies were an extension of state government done through granting, and say that really much of our human services infrastructure is treated the same way. So the state became a funder, and it's an interesting thing because this pits constituencies against each other. I think everybody up here would likely say that they're strongly supporting of the union, strong supporters of the state workers. But the human services system that we built offloaded a lot of services to the nonprofit sector to lower the cost of service delivery to Vermonters by looking the other way from the fact that we were doing it, giving not enough money, not enough rate of growth to the nonprofit sector to pay their employees fairly, to provide the benefits and the work stability that those people deserve. So we have a whole system, a really critical, infrastructure that we've built that in some ways is built on underpaying the workers who are delivering that, and there are regional inequities, and to bring that back inside state government would substantially increase the cost of doing that. And I'm not saying that we shouldn't look at that. I think we need to actually look under the hood and say, what did we do? It took us decades to build this, but what did we do? Is it what we want? Is it fair for all concerned? And then just really quick to your first question, absolutely the House and Senate leadership and the majority caucuses are going to fight to keep those cuts away. Within our power, if possible. And some of those are going to be federal, and they're not going to be in our power. And then it's going to be a question of whether we can find a way to fully fund them. But I think we're committed to it. I think we know it's coming, and we're trying to prepare to be ready to win that battle.
I just want to talk a little bit about the appropriations process, because you said, well, what are you going to do? But things go through the Appropriations Committee. So what often happens is, that maybe a group within the legislature will lobby the Appropriations Committee for a particular sum of money or for particular funding, something like that. And I think that in this case, definitely there's a strong, I would say, caucus commitment to that funding.
appreciate the conversation about the designated agencies. I've worked as a state employee for the Agency of Human Services, and I've worked for the contracted nonprofits who are paid significantly less than folks who are working for state agencies. And I think what that means on the ground for people who are living with disabilities is that they're receiving services from people who are not making a living wage, who are living under chronic stress themselves, and are often right out of school. So we have people who are really the least qualified, the least advanced in their profession, perhaps the most idealistic, but certainly the least experienced in their work, serving the most vulnerable people in our community. And so that is something that has to change. And it might change through, doing something about the designated agencies. It might just change by actually appropriately funding. But given what we do know about the federal government and what might be coming, I think what we're going to need to do to preserve those services is look across issues more. Instead of doing these cause against cause, we have one advocacy group come, and the folks living with disabilities have really good stories and they're really well organized, so they get the money, and the housing agencies don't because they don't have as good a grassroots organizer who's driving people up. Even though those people are in just high need, we need to have folks in the legislature who are able to look across those issues to say, how do we serve both of these issues in a way that everyone's needs are going to be met? So we have some momentum right now around solving early child care and elderly services in the same package. What does it look like to solve the housing problem and folks living with disabilities in the same package? What does it mean to sort of look across issues to find our common humanity and solve some of those funding challenges from there? And I don't think we can do that when we're caught in scarcity mindset, even if we're caught in a financial scarcity situation.
Excuse me. So I want to start my answer by saying, I just want to remind everyone that we are constantly hearing from this governor the same talking points. And one of them is always that I am here to protect the most vulnerable. I am here to protect the most vulnerable. Okay, this said by someone who signed off on a budget that cut attendant care services to people with severe disabilities, quadriplegia and paraplegia. You can't make this stuff up. It's morally bankrupt. It's unconscionable. And so for those of us trying to have this conversation in these committees and in the hallway in the State House, and all anyone wanted to talk about with us was, were we going to deliver the $20 million tax cut to property taxes? And we're saying at the same time, can we please talk about the people who are about to lose their attendant care? I can hardly get the words out because it is so incredibly infuriating. So we're fighting that battle. We're also fighting the cuts to developmental services. We had to restore $4.3 million that was cut. All this while we're hearing, I'm here to protect the most vulnerable. And so to your question, what do? We are constantly trying to fill in these holes that have been carved out while, he is not, our governor is not Trump. And I'm not going to say that they're the same, but the method is the same. I'm going to have the same talking points over and over and over again. And while you're focused on that, I'm going to make these cuts, and I hope that nobody really calls me on it. And it's very difficult for us in the legislature to explain to people outside what's happening. And so it's going to be a different session around that. Sorry.
No, I'm not going to repeat anything everybody said because I actually agree with everything that's been said up to this point. But in addition to hearing the governor say he was protecting the most vulnerable, what we also heard was we are not going to have any new fees or any new taxes. We aren't going to have one new fee. So not only is he pitting the disabled community against the people who need mental health services, but he's pitting any human service need against clean water because we're trying to balance this budget with no new fees to protect our clean water. So it gets very complicated. And so I believe that our commitment is to keep those funds there and to try to ward off any cuts. But I think we also have to be more creative about the way we look at the way we provide the services. we are kind of stuck in a system that says we should provide services in a particular way. And one of the things that I am thinking about is we had a woman come up on, I think it was Disability Rights Day. She was talking about her son, who has 12 case managers. Now that's ridiculous. How we're spending money in 12 different programs to have a case manager for this boy of hers, and he's not getting the best services he can. So we need to look a little more creatively at the system within which we provide the services, because I think there are ways of doing it that will meet people's needs much better than the way we're doing it right now. And that goes for the mental health system, the substance abuse system, all of it.
I think everybody here at the table is proving my point that this system is broken. It doesn't work. It's not going to work. Everybody's pitted against each other. We've got divisions. Nobody's being treated equally. You can't make this system work. Capitalism is a scam, and until we all are willing to make some changes, we're going to be pitted against each other.
Well, I hope you continue to make the system work marginally. I admire your efforts. I've been arguing against the scarcity policy. I really think that we have to understand that as human beings, we have talents, we have resources. How can we share them better? I'm a multimillionaire. I have a disabled child. I can get the best insurance policies. I can buy the best services for my child. My child probably will go to a school for dyslexics. I can spend $500,000 a year curing my child. I think we have to begin to talk to the humanity of the people who are multimillionaires and convince them that it's to their interest to voluntarily give some of it up. Until then, we'll be operating, you legislators, some of whom I know well and I admire, will be operating in, as Erin says, an impossible system. I'm not saying that you should stop trying to do that, but I think we have to begin to think in other ways. And I think we have to begin to talk to rich people in other ways than we have, and not just assume that if we bring this up, they will move out of the state. You know, they will give their money elsewhere. I know some very humane, rich people who want to be convinced that there is a better system. And I think we should spend some of our time talking to these people.
When are we voting for an alternative currency independent of the federal treasury to fund basic income and survivor reparation rights for residents? Not just those are two topics would like to become protections for all residents, but on top of that, universal health care for residents too. When can we create our own currency value? Maybe something like a Bitcoin platform, independent of the federal treasury.
Well, there's a group in Windham County that deals with alternative currency and work exchange, and I think that's going in the right direction. I've tried to join it a couple times, but they never contact me. So I think it might be a little inefficient. I would love to give some services for free so people would come to my house and do things I can't do, I think an alternative currency would be fabulous. It would be our currency. And we could base it not on the fluff of investment, but what resources are backing, carpenters, plumbers, teachers, artists, all of whom want to share their talents with the world. How can we release the wonderful, charismatic beauty of the arts, of education, of human services and healthcare? That's the question.
I'm not quite even sure how to answer that question.
Could you speak a little louder, because the mic doesn't
I'm
actually
not,
carry.
I'm not sure how to answer that question. I would like to see everybody have the same income, and so everything gets funded that way, whether it's disabilities, people with disabilities, or housing. Everybody has an equal share and an equal investment in the country, in the world. And so I'm not quite sure how we can move ahead with that. I've been invited to join that group a few years ago, Windham County, and I couldn't make it work. I don't know how to, I'm a plumber, I do heating systems. I don't know how I can survive on some sort of a local currency. And until we make some big changes, and maybe they have to start small, I just don't know how to make it work, how to get started.
So I think there is something to be said about a barter system, which is basically what I think we're talking about, that Jerry was talking about. But I will tell you that I don't think basic income is necessarily related or tied to our own currency. I think that they can be separated. We can talk about having a basic income without necessarily having our own currency. And I can tell you that, again, I'm not an economist, I'm not a monetary person, and Seth has tried many, many, many times to explain to me what Bitcoin is, and I don't really get it. So I'm leaving that up to people who know better, but I think that a basic income and reparation can be done without necessarily creating our own currency. So those are different conversations.
So I'm glad you mentioned Seth, because I was going to talk about Seth as well. For those of you who don't know Seth, he spent a lot of time in the Senate Economic Development Committee this past legislative session talking about Bitcoin, and we were able to make some real changes going forward related to that, which I know we both are happy to talk about it after the forum. I don't want to use my 2 minutes with that, but it's certainly an interesting idea for the state to move towards that. I think one of the things, while you were talking, I'm sorry, what is your name?
Nanya.
When Nanya was talking, one of the things that I kept coming back to is all of these big ideas which are important for us to be talking about in this town and in this county. We can't ignore the fact that we are setting all of these big ideas against a backdrop right now of incredible national fear at every level. And so had 3 different conversations today about work that we need to do within the legislature and within the state, and that even on issues that we are saying that things that used to be no-brainers seem to be no longer no-brainers, that the scourge at the executive office right now in DC has changed the dynamic. So all of these conversations around basic needs, a basic needs budget, or around, are you going to pay people, similar to what you were saying, a baseline so that everybody is starting from the same baseline to meet a basic needs budget. Things that made more sense to many people even 4 years ago now are somehow considered crazy. And so we're in a very different time period than we were 2 years ago when we were in Marlboro Tech Center talking about a lot of these same ideas, which is not to be discouraged, but this what's that?
It's the reality.
It's the reality that we're dealing in.
Jerry, I did join Time Trade, and you'll be happy to hear that there was a lot of Reiki on trade there. And I was looking for someone to clean my house, and I didn't find someone. But a lot of Reiki there. The separate financial system, there's certainly a long tradition in Vermont of a Vermont secessionist movement, and I think that's what would need to happen in order to move to our own currency because of interstate commerce and such, which is certainly an interesting idea that I'm not going to get into right now. But I'm proud to be part of a state that keeps on having those conversations. I think reparations is a big, scary word for a lot of people, but it's something that we, in any sort of good progressive policy, and I mean progressive with a small p, has reparations built into it in some ways. That's what we talk about when we talk about equitable policies, whether it's equitable tax law or equitable access. It's making sure that people who have been harmed by the state have more opportunities to access the benefits of the state. And I think that's something that we need to think about much more consciously than we have. I think we need to specifically think about that in the context of our Indigenous community here and the horrific state violence that happened not very long ago, the implications that has still for our human services system. I think we need to think about that in the context of people of color who have been living here for generations, totally ignored. I think we need to think about that in the context of violence, specifically against women. I think there's a lot of reparations to be made, and I think the way to do that is by talking about progressive policies that bring a much more equitable access to services.
To get back to the sort of barter idea, I've spent time in a couple different communities where barter was more of a way of life. In certain ways, one in Mexico and one in Ireland, but I think that we all need to sort of personally start thinking more that way and not in terms of monetary exchange of services, just in our everyday lives. I mean, it's hard to jump out of that system, but I think that there are ways that we can participate, like the time trade, although I haven't had time to do the time trade.
You have no time to trade.
Time to trade, right. Maybe at 1 o'clock in the morning. Anyway, I just think it's worth thinking about is how do we think differently about the exchange that we make for labor and services.
Thank you. I've agreed with a lot of what's been said. There's a few things. I do think we're in an interesting time with Bitcoin and other similar types of currencies in that we are, for the first time on a global level, experimenting with an alternative that's not controlled by federal banks within each country, and that by its design and structure is distributed across a global system. That's very different. It's new to the world, and it does have potential to disrupt some of the power that people have over us in the way that I think an alternative approved currency might. But it's early stages in its development. But I'm hopeful that there is something there that will take root and provide us a different path, a different way of being in the world and in an economy together.
I'm sorry, I'm unsure of how to answer your question directly because the U.S. Constitution would prevent the state of Vermont from developing a currency on its own. But I will talk about the idea of how you get more money into the system in order to fund the priorities, whatever they may be, in anything that we've talked about. We have a taxing system in this state that largely is funded on taxing principles from the 50s and 60s. It hasn't been looked at again. There's been largely there's an unwillingness to look at it again. And instead, when we need more money, we go after little bits of money that we can find here or there somewhere. Usually with a group that's easy to tax because, a common one is to go after a tobacco tax, which anyone that knows the demographics of people that smoke cigarettes is usually a tax on the poor and people with mental illness, which are the highest demographic groups that smoke cigarettes. We've been unwilling to look at more modern thoughts of how you tax to get more money in the system and get it in at better rates across larger areas Even the Blue Ribbon Tax Commission, which we commissioned years ago, we've ignored almost every aspect of that. So that's how you get more money in the system, so that you can fund what's necessary. It just takes a good deal of political courage to get it done, and probably new people.
And so I have to admit that the first thing I thought of was, I think it was Emily who said it as well, was secessionist movement. Honestly, that's the first thing I thought of when you mentioned that. When will we vote on that? But honestly, the reality is that there is that conversation going on, not here in Vermont, but I do think it is going on globally, and I do think
It's going on right now in Vermont.
So what I'm saying is, I do think that this conversation is happening. I'm not talking about in Vermont, I'm talking about in the Vermont legislature. We aren't having that conversation, as far as I know, in the Vermont legislature about coming up with a new currency. I'll trust that Matt was correct, that it's against our US Constitution. So, but I will say that, clearly there's a little disagreement about that out there, but that's fine. So I will say that we're being sold a narrative in this state, honestly, and in this country, about affordability and about we just talked several times about scarcity, and we're getting caught up. We do this when we go, when you walk into the legislature on that first day and you step into your committee on the first day, you are assaulted by the needs. You are assaulted by the needs. And frankly, we get ourselves spun around by hearing all of that and trying to figure out a way to meet those needs in the system that we're in. That is part of the reason why we aren't coming up with new ways to fix things. We also do not fund our agencies. We underfund our agencies all the time. And that keeps us from moving progressive and helpful policy forward. And I would love to see that.
Okay. The Worker Center's been in very fierce solidarity with the UVM nurses in their struggle right now. This question addresses that. In the recent contract negotiations at UVM Medical Center, University of Vermont Medical Center, safe staffing levels was an important issue for the nurses. This has also been the case at other hospitals in Vermont. What can the legislature do? Specifically, what can the legislature do to ensure that hospitals are staffed at levels that provide safety for both caregiving staff and patients?
So I think this actually, I appreciate the question about safe staffing levels at hospitals. I also think that that's true in schools as well. And I think that we have that conversation quite often and try to find a path forward with that. We need to make sure that safe staffing levels mean that we have appropriate staff, not only in the staffing body, but in the numbers, the numbers of staff that we have, and make sure that we are fully staffed. Most hospitals are not fully staffed, and they're in fact, the UVM, one of their biggest concerns was understaffing. We also have a shortage of nursing. You know, we're bringing in our nurses from all over the country all the time. And but part of their concern is lower pay. And we need to make sure that we have quality nurses. They need to be able to have, they need to be able to afford to advance their education, unfortunately. That's pretty difficult to do right now. Again, I'll say it's the same in schools as well. I think that we are going to see a shortage coming. We're starting to see a little bit now of teachers. And so we need to make sure that we're supporting policies that work for higher education and find a way to increase our staffing levels.
So your answer is that just supporting policies, is it, as far as specifically what the legislature's role might be in addressing any of the issues you just raised, is to just make sure you support legislation that comes along, or is there a particular process you're aware of? Okay.
So that's what we do.
Yeah.
We develop policy, we develop legislation and that meets the needs of Vermonters.
Okay.
I don't claim to be an expert on how to safely staff a hospital. But I think if the decision was made to move forward with legislation like that, we could determine sort of a baseline for what safe staffing is, and implement that, perhaps across schools as well. You know, because you couldn't say one without the other. As Emily pointed out, there's comparisons between the two. But I think that gets into the next larger question, which brings us back to the whole conundrum of healthcare from the start, which there's going to be, you know, the first thing that comes up is they're going to say, well, there's an increased cost. And then it goes back to, what does the Green Mountain Care Board allow for them to increase? And then what does the CEO of the UVM Medical Center make as opposed to what the nurses are making? And so what's the core concept of what we're trying to get at with healthcare? Is it to make, is it supposed to be a system where we have this hierarchy of people making more and more money out of it, and insurance companies sucking a huge portion of that out of it? I think the question, there's ways to address that issue through determining what a safe staffing level would be and then implementing it. But I think overall it brings it more to the idea of getting people to understand that they're paying taxes for healthcare already. So we might as well just bite the bullet and start to provide healthcare for all.
So definitely we have some options, and I think that thresholds are something that we could evaluate. A lot of the legislative authority around that level of detail was given to the Green Mountain Care Board, and we set the policy framework around the way that they operate. But that because the Green Mountain Care Board is an extension of the legislature's power, it's something that we can influence. So I think I'm not an expert enough to know exactly what we have done in recent years on this, but I think it's something that may come out in the wake of this particular negotiation and the highly visible parts of that negotiation in the political process. And so it may help surface that issue and have it be something that the committees will actually look at this year and see if there's something that needs to be legislatively enacted. The other piece, and I think Matt was speaking to this, it's really interesting. You know, in one way, the Green Mountain Care Board was designed to keep the rate of growth of healthcare down, so keep healthcare affordable by limiting the rate of growth. But when you squeeze on that end of the balloon, you know, it doesn't just, things don't just disappear. It puts pressure somewhere else. And in this case, you know, if we support, and I do support, better wages for nurses, then that's going to push us on the rates. And the rates are going to affect people who can't afford to pay for health care. And this is why the global solution is so important.
Just to clarify, you just said that the legislature has oversight and authority over the Green Mountain Care Board?
So my understanding, and somebody can correct me who was there, Jeanette particularly was there when it was created, but my understanding is that the Green Mountain Care Board was a creation of the legislature, and so it serves Vermonters as an extension of the legislature's authority.
I think the issue of CEO pay is a really big one, and it's, you know, we keep hearing, well, in order to attract somebody who's good to manage a hospital, you need to have that kind of, you know, offer that, whatever it is that, I forget what he gets.
2.1 million.
2.1 million, yeah. And it's just so blatant. And I just go back to reading Paul Krugman's book, Conscience of a Liberal, talking about that it used to be unseemly for a CEO company to earn more than a certain percentage of what the workers earn. It was just part of the culture of a business, was that it was just not seen as unseemly, in this sort of sense of, you know, entitlement about that kind of salary is really affects what the nurses are being paid. And then what they're doing, they're in the trenches doing that work. So I think that's just another thing to look at in terms of our thoughts about what we might do as a legislature.
And that's a nonprofit.
Mm-hmm.
Nonprofit.
Non-profit corporation.
Right.
Yeah.
I agree that looking at appropriate ratios between CEOs and frontline staff is a huge priority. And again, I want to say that I'm going to do it this year, and I am new to this, and I have no idea what happens inside that building, really. So,
You'll find out.
yes, I'm going in with very idealistic eyes, but I think that is one solution. When we mandate ratios, though, which we do in a lot of industries, we do that in childcare. I think we have mandated ratios at the retreat. And we have a lot of places where that's happening, where we have staff shortages that make meeting those ratios impossible. That's a huge problem in childcare, and I know that more professionally, and then personally, I just have friends who work at the retreat that talk about the challenge of staff not coming into work, and then they're not meeting their ratios necessarily. And so staff shortages is a much bigger policy issue than just an issue of pay. While pay is a huge part of that, it's also benefits and how we pay for benefits, which we've certainly talked about more than enough tonight, and we could keep on talking about forever. It's also education and how we fund education, and whether or not the state is willing to forgive student loans, or if a business is willing to forgive student loans in exchange for someone staying a certain amount of time. It's whether or not, I believe that the bulk of the nursing staff, or a huge proportion of nursing staff in America, are women of color. And we certainly have heard enough in the last year in Vermont to know how unappealing this might be a place to live for someone of color. So I think there's a lot of different, both policy levers and social levers that we're going to need to pull to deal with the actual issue of shortages around ratios, which I think is a problem in most of our healthcare and childcare facilities.
Certainly, as I called out, the CEO of UVM Medical Center makes $2.1 million a year. And to loop it back to what we were talking about earlier about taxing levels and how we did not take the advice of the Blue Ribbon Tax Commission, and I know that was buried inside the budget in its last iteration in the Senate that was then signed out by the House. We have tasked the Joint Fiscal Office with pulling together a new, essentially, Blue Ribbon Tax Commission with updated figures related to taxes across the spectrum. And I bring this up because there isn't a whole lot, as Tristan said, that we as a legislature can do to insert ourselves directly into this conversation about ratios and staffing ratios. However, I was not in the legislature when the Green Mountain Care Board was formed, but we need to be better about making the Green Mountain Care Board more accessible to Vermonters in general. And I know they have taken their hearings on the road in the past, but what needs to happen is those hearings need to happen in the State House from January to May, when we're actually there and the committees of jurisdiction can have oversight on the work that they do, and that I don't serve on health and welfare, but those folks who are buried, immersed in this information about staffing shortages around the state can ask the relevant questions. And right now that's not happening. So we have this entity that's been tasked with oversight, but those of us who've tasked them with oversight need to be making sure that they're doing what we have asked them to do.
So not only do we need to do that, but the Green Mountain Care Board is appointed by the governor. There is not a primary care person on that board, which is just the most ridiculous thing ever. And I'll admit that I voted against the last appointee to the board, because 2 months before he was appointed, he said he thought the Green Mountain Care Board was unnecessary and should be dissolved. So
and then he got
appointed. But anyway, so I don't think we should set mandatory staffing level standards. I think that's we're not the experts on that. We should, as we did with prescriptions, we suggested, some people wanted to say you can only prescribe 10 opioid pills. And it didn't make any sense, leave that to the doc. But we did say you have to be very careful and you have to look at how you're doing that. And it has made a difference. I've been told that the prescribing level is lower. But we need to increase the number of health care providers in this state. We don't have enough primary care docs. We don't have enough physician's assistants, psychiatrists, nurses. And we can do that in some ways. We can provide more money to educational programs that actually train people. We can provide, we have a loan forgiveness program that we can be accessed by primary care and all health care providers. And the governor wanted to cut it last year. So we wouldn't have had any money to do loan forgiveness. But we can do that, and we need to, those are some of the things that we need to do because we need to have more people. Staffing can't happen if you don't have people, and then you have mandatory overtime, and that isn't to anybody's advantage to have people working double shifts. So it's very complicated, but I think that we can hopefully do something. But I don't think we should be setting mandatory staffing levels. Oh, I'm sorry.
I'm a not-for-profit candidate, and maybe the hospital is not-for-profit, but I also believe everybody should be paid the same. So the nurses and the doctors should be paid the same. They should have the same health care and be provided the same benefits as the CEO. And there'll be plenty of nurses and there'll be plenty of people to provide care. We'll have meaningful work for everyone, and we'll have people doing the jobs that want to do it for the job and not because of the pay. Profit comes from two places. It comes from either underpaying the employee or not paying for the cost of goods and services. And the two prime examples here in southern Vermont are over in Bennington. There's the polluted wells. The company picked up, moved after they made their money, they moved to New Hampshire. And we have Vermont Yankee with our radioactive waste on the banks of the Connecticut River. Those stockholders should be, there was no profit to be made. That stuff needs to be taken care of. And so a hospital, a doctor, a plumber, a nurse, everybody should be paid the same, and everybody should have meaningful work they enjoy, they want to get out of bed in the morning, go to work, and we won't have any problem staffing hospitals. We might have trouble finding a CEO, but I think somebody will be willing to take the job. And so if everybody's working for the common good and everybody's getting paid the same, I think we'll have a much more pleasant world to live in.
I agree with Aaron. But in the meantime, I'm a nurse. I went to Marlborough. Some of this is fiction and some of this is fact. I went to Marlborough College in the 90s. I came from an impoverished background. I studied the sociology of poverty. I graduated with highest honors, but I was in debt, $50,000. But then I realized that there's no jobs for BAs with sociology. Sociology ain't worth a goddamn anything. So I went to nursing school because I want to help people. I went into debt, another $30,000. So I got a master's in nursing, and I emerged from there with a $60,000 debt. And so I got to find a job to pay off that debt. But I don't want the pushy jobs. I want to work in the trenches, in the public hospitals. So I go there and I work my you-know-what off. And I realize that, the society does not value nurses. They say they do, they say they value me, but what about my debt? What about my working conditions? That's what we got to deal with.
So anyone else from the audience, particularly if you haven't had a chance to ask a question yet?
I read the law. I'm not there. I don't expect I really will be. But, I would write that law. I would try to get that passed. Nobody should have to work more than 8 hours a day, especially if you're taking care of somebody else, whether you're a school teacher or a nurse or a doctor. To work under that kind of stress and to take care of people is probably the most valuable job there is that I can think of. I'm not qualified to do it, but I think that I would certainly be happy to write that law.
Well, this is going to sound kind of waffling, because I don't believe in mandatory overtime. On the other hand, if I'm in a hospital as a patient and the person who's supposed to come in to the shift at 11 o'clock calls in sick, their child is sick, they had to take care of their child, I don't want the nurse that's taking care of me to walk out because they aren't required to have overtime. Now I have no one taking care of me. So I think that it goes hand in hand with not having enough people. And it isn't just that we have we have a huge nursing shortage in this country. It is huge. And one of the problems is that we have a huge nursing instructor shortage. And so it kind of snowballs. And I don't believe in mandatory overtime. On the other hand, I don't want somebody just leaving their shift and no one to cover it. And I don't think that I want the CEO to come in and take care of me, because I don't think probably most of them are they don't know how to take care of me. So I would love to do it, but I would only love to do it if we can guarantee that there will be somebody that actually can come in and take over that shift. So I know that doesn't satisfy your question, but it is a complicated issue.
Well, I think the first thing that would need to happen in order for legislation to get out of committee, which is, if we just break it down, like that's the first thing that would need to happen, is before it even gets to the floor, it needs to get out of committee. And so and we should talk after this, I know Jeanette would be happy to talk to you. Neither of us serve on health and welfare, but the first step is to have a drafter draft a bill similar to, you said it has already passed in Rhode Island or the other states that you mentioned, Massachusetts, and we need to have people come in and we need to take testimony on it. That's what needs to happen, because this is not just an issue here at the retreat, it's the issue at UVM, it's the issue in hospitals across this state. It's going to continue to come up. So we need to start the conversation within the State House and have that testimony. So we are in flux in the Senate right now. Our chair of Health and Welfare has retired, so we're not sure who's going to be in that position, but I will certainly make a commitment to you to talk to the incoming chair and talk about what that draft legislation would have to be on the board in order to have this conversation started. I make that commitment to you.
I certainly know that my friends who are nurses who work in the healthcare profession and have mandated overtime, how it really destroys huge swaths of their life, their ability to pick up their kids at school. I work with someone who works, does healthcare in the evenings and then works full time in the office next to me during the day. And if she gets mandated overtime, that means she's working a full 24 hours, and then she's supposed to be counseling the people in the office next to me. And the snowball of that is incredible. And I think one of the most powerful tools we have as workers is to strike. And the premise of the strike is exactly that fear that Jeanette described, right? It's what happens when no one's there to caretake anymore. And then I'm also thinking about what happens when there's no one there to caretake anymore. So it is something I would want to talk about a lot more, because if it has happened other places, it could happen here. But I'm really curious about it.
Becca's made the commitment to look at it. We meet regularly as Windham County Caucus and keep each other informed of issues and things that we're working on together. So I think that that's something that we can pursue.
So I'm intrigued, and I'd like to see some of the testimony that comes out of it. But clearly, part of what has happened in the modern economy is that workers have lost leverage in the conversations about their lives, and so my guess is that in Massachusetts, that it was highly contested, that the leadership of the systems hated it, that probably the doctors probably hated it, but that the nurses loved it. But it probably forced change because no senior administrator can actually leave themselves unstaffed without opening themselves up to substantial liability. And so as a leverage point for sort of workers' rights, I think it could be potentially very powerful, and I'm just, I'm interested in learning more.
Thank you for the question. My partner Andrew is a emergency room nurse. He was an emergency room RN and then became an emergency room nurse practitioner. Such he's supposed to work 12-hour shifts. I don't think there's ever been a time when he's been out of the house for less than 15 hours during that time. That being said, my immediate gut reaction to this goes back to what Jeanette was saying earlier. I can't get the image of patient safety and making sure that we're not compromising patient safety out of my head. I know some of the stories that I've been told when he gets home and says what he was doing that's caused him to be late. And I sit there and I go, well, thank God he was willing to do that because for that person. And I guess it comes down to the fact that it takes a special person to be a nurse. But I would be willing to look at what the law was that other states did and what they saw as side effects and how they dealt with things to mitigate those concerns of patient safety. I think the most important job we have in the legislature is to try not to box ourselves into a corner one way or the other, but be willing to look at information when it comes in to see if it addresses those concerns so that we can move forward and hopefully steal some really good ideas from other states.
So I agree with what others have said. I have a really hard time with mandatory overtime. That being said, I also have a sister-in-law who's a nurse practitioner, and frankly, she gets an awful, I think maybe it's nurse practitioners who seem to get nailed sometimes even harder, but she likes it, so she gets longer time off elsewhere with her children. So she accepts it. So maybe a voluntary sort of system. I absolutely would support looking into this. I really would, and I think we should look at this in the upcoming session and see what we can do to meet the needs. I also think that it's really important to do, as I think it was Jeanette who said it last again, make sure that we are addressing our shortage, because that will help us.
So I think we probably have time for one more question from the audience.
I got a few things on my mind, but I thought it out so I can be fast. One was when the question of currency came up, what got left out of that discussion was the state bank. And a local currency, whether it's in a town, a county, a region, a state, is by definition an alternative currency, and it needs, in order to exist, it has to be exchangeable in a bank, and that's where the state bank can play an enormous role. Not that the state bank itself is exchanging the currency, but it can enable local banks to do that. I shudder every time, like Jeanette does, when I hear the word Bitcoin, because so few people understand it. It will mean that so few people will control it. And that will not end well for the people. And that's almost guaranteed. It's like the internet, which was going to bring democracy to everybody in the world because nobody could control it. And democracy throughout the world has been declining at the same rate that the internet has been increasing. last thing was that most concerns me is that as I listen to all of the legislators talking about being able to have conversations, as a school board member, my greatest challenge has been to understand what we teach our children. And in the same way that corporations control our health care, corporations control our education. And I feel like our legislation, I don't know who else, but at least needs to begin to take control over what or how to, in some way, to be in control of what our children are taught. And that gets back to being able to understand and develop and talk about the values that underlie every single one of these issues.
So what is your question?
I don't have one, I just needed to make a speech.
Well, that gives us such an
Let us respond to that.
Let us respond to
To
that.
his speech.
Yes.
And then we'll stay long enough to have Seth's question, but no, let us respond first.
Let us respond to that.
And then we'll stay long enough to take
Is
one.
it willing to stay long enough to, because there was another question.
Yeah.
Okay, someone did mention a state bank, and I've been for a state bank. This is the third time I've been a candidate. The question is, what kind of state bank? And I think it should be a state bank in which a certain amount would come from the government, but that individuals, corporations, wealthy people, comfortable people, poor people would be encouraged to donate, to donate to that bank, to raise enough money to fund all these services that that my esteemed legislators say they can't get through the State House. Until we have a new currency system, we have to raise money. How can we raise money? Not with a state bank that's controlled by the state of Vermont, but a state bank that encourages the concentration of wealth, not in the hands of the few, but in the hands of the bank, which is a generous bank, and which is a bank that wants to fund health care and education and decent salaries and pay people what they're worth, short of a socialist society, which I'm totally for. A state bank, sorry, one more sentence.
No, it's 30 seconds.
Oh, a state bank, properly conceived and well-run, would be a bridge, an important bridge to an independent financial entity which could begin to solve our problems if that bank was able to raise a lot of money.
I think a Vermont State Bank is a good idea, both Jerry's and a more conventional bank. I also agree with you on the Bitcoin. I think that a few people are going to control it, and it's just a continuation of the system we have now.
Well, that's what donors do too. People who can donate have money versus people, if what they were given was the conceptual idea of money equally as the people who already have what they could donate.
I know. Okay,
From
could you
business
just
level.
let him answer the question and then we'll have discussion.
Well, he's asking a question about Bitcoin. I'm trying to explain it in a way he might understand.
So I agree with you about the Bitcoin. I think a few people will control it, and it'll continue the system we have. I also am concerned about what gets taught in the school. I don't know how to fix what gets taught in the school, but I know that a lot of reality does not get taught in the school. Even the textbooks and the college classes and the from elementary school right up on through we don't get taught about what happened to the Native American people, and we don't get taught about all the things that matter. We don't get taught how to farm, or not as much as we should, in my judgment. We don't get taught how to be nice to each other. We get taught how to get a job, to graduate and be part of this broken society. So I think education is probably a really important place to start making changes.
So I'm not going to talk about the state bank. We've had this conversation before, and we can open up the conversation again in the legislature. But, and I'm not on the education committees, so I don't know how much curriculum we mandate as a state, but I do believe that we do mandate some curriculum.
Broad frameworks.
So, but what I'm going to take my time to read. I am afraid that we're focusing in education, we're focusing a lot on careers, getting a job, and that we're abandoning the liberal arts, which is where I think that people are taught how to think. So I'm going to read a quote by Alexis de Tocqueville. Poetry, eloquence, memory, the beauty of wit, the fires of imagination, the depth of thought, all these gifts which heaven shares out by chance turn to the advantage of democracy. And even when they belonged to the enemies of democracy, they still promoted its cause by highlighting the natural grandeur of man. Literature was an arsenal open to all, where the weak and poor could always find arms. And I think that we've abandoned teaching liberal arts because we're so focused on careers and technical, the STEMs, which I think are important, but we've abandoned this, and I am sad about that.
So 2 minutes is not going to be enough. I'll just try to bullet point it here, which is I want to just say about Bitcoin, the only constant is change, and people who feel like they don't understand it need to wrap their head around the fact that this is the future in some way, and it's going to be here in Vermont just like it's going to be in other parts of New England. So we can stick our heads in the sand and ignore it, or we can learn about it. So that's the first thing I want to say. I'm pretty fired up about, and I know, Spoon, you've made this argument before, about corporate control of classrooms. As one of the only people here on this panel who has actually been a classroom teacher, I could not disagree with you more. I have taught Howard Zinn in my classroom. I have taught Native American history in my classroom. My master's degree is in Native American history. I have taught feminist theory in my classroom. And all of that has happened in this district. And so I understand the fear, and I understand the concern. The concern should be connected to No Child Left Behind and how the curriculum has been narrowed. But in terms of what Vermont gives our teachers, we have an incredible amount of freedom. It's called the Vermont Frameworks for Learning Opportunities. It is not dictated to teachers what they need to teach at grade level like it is in many other states. If you're in New York State, every 8th grade teacher in history is teaching the same thing, basically the same week. That is not what we have here. I am proud of what we've done here. When we have brought social studies and history teachers together across the state to try to figure out whether there should be a mandated curriculum, we all come back to the same thing, which is that is a slippery slope and it's dangerous. And yes, I'm angry about it, and I will talk about it to anyone who wants to listen. My kids are in public school. I believe in public school. I've taught in public school. We are not corporately controlled in this state in our public schools.
Bye. I've already spoken about the state bank twice, so I'm not going to speak about that again. I think it's a wonderful idea, and I think we need to talk about it very differently. I know that the conversations around ethnic studies, curriculums have been moving, and I think that's great, and I think it's a really slippery slope about what we mandate from the legislature that needs to be taught. Though I agree that civics is wonderful, as are liberal arts. What I actually want to use my minute left, going back to the previous question, and talking about, yes, I think that nurses and teachers have to be very special people. There are jobs I would not be able to do no matter how much money you gave me, but I am tired of people who are in caring professions being taken advantage of because they care. It is not acceptable. It's not a way to build an economy. It's not a way to build a society. It is gendered and terrible.
Period, yes.
Yeah. And we need to make change there, and historically that change has been made with unions, and I would love for that to come back. a lot would have to change in Vermont for our unions to have that level of power. And our unions need to delve deeply across unions about how gendered the politics of unions are. Because we cannot come together on any of these issues, because the concerns for caring professions unions and the concerns for other unions that are sort of the historically powerful unions are diametrically opposed to each other in so many cases because of gender dynamics. And if we continue to act that way, we're going to continue to say that people who are in caring professions are there because they care, and so they don't need the same protections that the rest of us do.
I've been a teacher in public and private schools, and more recently working as an artist in residence, particularly in Brattleboro schools. And I have to say that teachers do an amazing job of bringing humanity into the classroom. And I think that just the one thing that I do notice is, and it's really lack of funding, is that 20 or 30 years ago, there was more money in school budgets for outside arts to come in. And now it's much, much diminished. And I think that that's a really consequence of, the funding things that we've been talking about, the scarcity issue. But I think given that, I think that we have wonderful teachers, and what teachers are asked to do in this climate is just unbelievable, because they are dealing with kids whose parents are incarcerated, they're dealing with kids who, and the kind of work that they do, I just admire it so much, and I don't feel like they're on a corporate track at all.
Well, Spoon, you gave us a lot to react to, and you and I, we always have a lot of, usually long, robust conversations, but I'll comment on two things. One is there is a Bitcoin and related cryptocurrencies, and that whole technology, by their nature, are distributed. They're not governed. However, there is a threat, which is the corporatization of private distributed ledgers, which is a real risk to the openness that system creates. So I disagree with you on the one hand and agree with you on the larger point, which is that, and that's where I wanted to pivot to, which I think, you use the word corporations. I actually think it's really about the individuals behind the corporations who have been able to take control of the system. They use corporations as one method of power. They use tax policy as another method of power. They use fear and intimidation and propaganda as a means of power so that they win in our system. And I think we should be calling out the individuals. I think when we talk about corporations, we end up actually letting the individuals who are trying to take control of our economy and off the hook. And it's really about people. It's about, the corporations are just a vehicle for people to exercise power when in that sense. And they're also the vehicle for a single person business, and they're sort of neutral. Corporate entities are neutral in that sense. It's what people do with the corporate entities that matters, and it's about power. And I want to call them out for their power, I want to limit it, and I want to fight back.
So it's getting kind of late. I know that there's one question still out there, so I don't really feel the need to comment.
So once again, I'm not going to let Matt control my comments. As much as
I would never control your comments.
But I can't let this go totally on only Becca's passion, because it's a passion of mine too, as far as our school systems. And Spoon and I know we sit at a lot of meetings together on occasion around education. And I'm not an educator. I can't speak from the classroom perspective like Becca can or Molly can, but I certainly have had plenty of experience in the education system with almost a quarter of a century on school boards myself. And so I feel pretty strongly in agreement with Becca about how we really do allow in Vermont, and unusually so in Vermont, allow our teachers a lot of autonomy in the classroom, what they teach. There is a framework, the Vermont's framework of standards is there. We do not, we have adopted Common Core, and Common Core is, if we don't follow Common Core to the level we are required, we would not get federal funding, but there is so much flexibility around that itself framework. So I've talked to teachers who have said, I have so much flexibility. Where the challenge comes, honestly, is time. And how much time do I have in the classroom to teach? Because, as I think it was Molly who said, our schools are dealing with totally different issues today, and it is really hard to fit in all the needs in any given day in a classroom. And there is a framework that we need to follow. So we want to make sure our kids get the best education they possibly can. And that's what we're working on.
Well, this big kids question is related to broadband build out and related to Article 1, which you brought up. We have an existing borderless municipality. Software-defined borders are now a thing. Physical borders are gone. You might as well think
that's right.
That's gone. So scalability right there, that addresses that scalability issue. Universal basic income with a state bank, like you guys had talked about. If that becomes a state exchange bank, and you split the transaction fees across that, you can feed a pool, give people distributed apps that share educational resources, whether it's civic engagement, even platforms, things like that, that share processing power to distribute that network. The municipality, I guess, is the word instead of the state currency. What are we going to do to address the broadband build out that needs to be done? Digital healthcare is the future.
So we'll do this as a kind of lightning round.
We're going to continue the policies and programs that we've been working on, but we have to do more. We absolutely have to do more. And in fact, it's happening right now. I mean, the conversation is ongoing as we speak all the time about how are we going to do it. I don't know as we'll ever reach that last household on the end of some hill, road, which to me isn't fair. And I've had a lot of conversations around community provided broadband or services, and from what I'm hearing and understanding, it's going to be cost prohibitive to do that. And that may be the one way, though, we can get it out to our last mile. I don't know, but it is critical. It is critical to society, to our democracy, let's face it, and mostly to our economy. We absolutely need to be able to have accessible broadband to all our areas of Vermont so that we can have small businesses, which is the cornerstone of what we do here in Vermont. So we keep fighting for it.
I would be concerned about what cost does that come at to go there. What are we sacrificing to be able to get to that? And it's politically dangerous to say this, but to get to that last mile and spending the money there, what are we giving up on being able to reinforce with more modern technology in other areas of the state that could help in other economies that you've been talking about?
5G. Coming, 5G.
So, well, we've taken so long that 5G may come. By the time we get some of this solved, that is the sad reality. And 5 years ago, we were trumpeting how we were one of the best in the country for broadband saturation, but then broadband got redefined and suddenly we were one of the worst. Yeah. And that was because what we had was inadequate. It is expensive and politically challenging, as you know. I think last year we made an effort to free up another couple $1 million, and
that didn't work.
And it didn't work, and the governor was opposed to it as well. There are no easy answers. I know that there are many of us who want to see a solution, and we keep working at the edges of trying to figure out what it looks like. But the bill to do the last mile, full, real, honest to goodness last mile, high quality broadband is hundreds of millions of dollars that will never be recouped. And then there's places like EC Fiber, which is bringing fiber into communities at at a sort of larger municipal level. That's what we're trying to figure out. Can we scale up that kind of a system, or but we don't have the answers yet. And it may be that 5G takes a slice of that off and makes the problem more manageable. I'm not sure yet, but it's disheartening and it's hard.
And it's particularly hard for people who are, really suffering, trying to run a business in a situation where they don't have that access. But, I think we need to just keep discussing the problem and see what we can do.
of all the things that I don't understand yet, this is the top of the list, because before I started working locally in Brattleboro 8 years ago, I brokered public-private partnerships overseas in communities where people were at $1 a day salary levels. I brought last mile connectivity to the Philippines, where we solved the humidity and the foliage problem. I brought last mile connectivity to Tanzanian farmers, which solves any distance problem you could possibly imagine. So I do not understand why we cannot do this here. It makes no sense to me. There is no financial barrier that makes sense to me. There is no technical barrier that makes sense to me. And that was 10 years ago when technology was in a totally different place than it is now. I think when we do it here, I would like to do it less with mega corporations who are working with $1 a day, but if that's what we have to do, I think that co-ops and either municipal ownership of co-ops or community co-ops are a great model for using those exact technology solutions that I used in Tanzania and the Philippines, and I will figure this out.
I can attest to the fact that I hear from Emily almost every day. You're my senator. I have no cell phone coverage right now, and I'm in West Brattleboro.
I need your number. I'm gonna complain.
So
that's just to scream into the phone.
We are, as Matt said, we're limited by the amount of dollars in appropriations that people are willing to put towards this particular project as opposed to another. And this is where I'm going to continue to look to our federal delegation. We need hundreds of millions of dollars to make this happen. This really speaks to the urban-rural divide that's not happening just in Vermont, it's happening across the country. We did an electrification project under FDR. We can do this again. It takes political will, but we need people representing us in DC who feel the urgency of it. And if they're not feeling the urgency of it, we need to let them know this is an important issue for rural Vermonters especially. And that it isn't just for people who are running businesses for their homes, but of course that's important. Some people in my district can't sell their homes because they're not connected. Nobody is interested in buying their home here in parts of Marlboro, and I know it's true. I talked to folks who represent Tunbridge, same thing. Homes have been on the market for years and years. Nobody's going to even look at them because they say, are you connected? So this is not a luxury anymore. It really isn't, and we have to stop talking about it like it is. So I am going to continue to engage our federal delegation about changing the conversation in DC about a similar project, a connectivity initiative in the same way that we've done it before. It's just political will.
So it's just not profitable for large corporations to do the last mile. That's why it hasn't been done. There's a group in central Vermont that took it on and has, I think it's 14 towns now.
Yeah, that's EC Fiber.
EC Fiber. And they have came to the legislature. They have their own corporation, their own municipality, and they have provided it to those communities. But that's the way it's going to have to be done, and that's more along the lines of the REA. It was done by the communities. It was a public project, and that's what we have to do, because we can't depend on the large corporations because it's not profitable for them.
I'm going to pass on this question.
This very stimulating discussion on how we're going to provide basic needs and services to Vermonters and by implication others in the world is contingent on our continued ability to have forums such as this, our ability to have meetings in our houses, to do creative things in our houses, all of which is under threat, and none of which has been raised at this meeting. I would say that our legislatures and others, we should be discussing what we are going to do if the attempt of the administration to take total power succeeds, or even if it doesn't succeed. What are we going to do when everything that we're concerned about is currently under threat in very specific ways? I just wanted to raise that, not to be nasty, but to say that These are things we should be discussing publicly.
Thank you, all of you folks.
Thank you.
Give this back to you. I assume you could hear me. It got turned off? No, I just turned it off, but like all the rest of it.
The last round of the...
Something, I just turned it off.
Okay.